Welcome to the Omni Dental Podcast. We are doing a deep dive today into what I think is one of the most transformative parts of dental care, aesthetic dentistry. And our mission specifically is to give you a really clear guide. We want to distill the signs that might suggest dental veneers are, the right solution for your smile.
That's a great way to put it, because we're not just listing things off a checklist. We're really looking at the difference between, say, a problem that professional whitening can solve versus one that needs the structural and aesthetic power of a veneer.
Right. And the expertise we're drawing on today comes straight from the source, from Omni Dental in Medspa.
Yep. They're located in Arlington Heights, Illinois, right at 305E Rand Road.
And the practice is led by Dr. Billis Poles, DDS, who brings, over a decade of experience?
Over a decade, yeah. And he's really focused on these aesthetic and restorative procedures. What's interesting about their whole philosophy is that it's not just about a quick fix. It's about top-tier, long-term health.
A patient-first mentality.
Exactly. Treating the person, not just the tooth.
I really like that emphasis on long-term health. Our sources also point to their commitment to advanced technology.
Oh, absolutely.
So it's not just the skill, it's using the right tools for accuracy, for efficiency, and, for patient comfort. That's huge.
It is. That blend of tech and experience is just vital if you want those predictable, really beautiful results.
And just so our listeners know, they serve a pretty wide area, right? Not just Arlington Heights.
That's right. They're a central hub for care for a lot of nearby communities. Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, DuPlain, and Elk Grove Village, too.
Perfect. Okay, that sets the stage. Let's start with the basics. Before you can even spot the signs, you need to know what we're talking about. So what exactly is a dental veneer?
Okay, so fundamentally, a dental veneer is a very thin, custom-made shell. Think of it like a custom-fit cover for the front of your tooth.
Like a mask for the tooth.
A perfect analogy. It's bonded right onto the front surface, and its whole purpose is to instantly improve the tooth's appearance. Its color, its shape, its size, even its length.
And they're made from a couple of different materials, right?
They are. Generally, you're looking at either porcelain or a composite resin.
So two types, and I imagine for someone considering this, knowing the difference is key. It affects the process, durability, the cost, all of it.
Everything.
Let's start with porcelain. You always hear it called the gold standard. Why is that?
Well, porcelain is really the top-tier material for longevity and for just pure aesthetics. It has a couple of massive advantages.
Okay.
First, it's incredibly durable, very resistant to wear and tear. But second, and this is the magic of it, is the aesthetics. Porcelain has this slight translucency. It mimics the way natural tooth enamel reflects light.
Ah, so it doesn't look flat. It looks like a real tooth.
Exactly. That's what makes it blend in so seamlessly with the rest of your smile. And crucially, it's highly resistant to staining.
Which is often why people are looking into this in the first place.
Right. So years down the road, after all the coffee and wine, that veneer is going to hold its brilliant color. It's a very powerful long-term solution.
Okay, so that's porcelain. On the other side of the coin, you have composite veneers. Who is that option typically for?
Composite is often the faster and more cost-effective choice. It's a tooth-colored resin that the dentist applies directly to the tooth and sort of sculpts right there in the chair.
Oh, so it can be a one-visit procedure sometimes?
Sometimes, yeah. It requires less lab time. So it's really ideal for more minor cosmetic issues or for a patient who is more budget conscious or just wants a quicker result.
But I'm guessing there's a trade-off.
There is. While composite is durable, it's just not as stain-resistant as porcelain. It might require more maintenance, more touch-ups over time.
So porcelain is maybe a 10 to 15-year investment?
And composite might need refreshing sooner.
Yeah. It's all part of that initial consultation, balancing the budget with the longevity you're looking for. Got it. So the big takeaway here is that both are fantastic tools for covering those common imperfections, stains, small gaps, minor crookedness.
They deliver an immediate and often dramatic cosmetic change.
All right, now let's get to the core of this deep dive. We've pulled out the 6 most common, most axable signs that veneers might be exactly what you need. Let's really break these down one by one. Sign number 1, small gaps between your teeth.
Yes, what dentists call a diastema. This is probably the most classic, straightforward use for veneers.
Sure.
If you have those little spaces, especially between the 2 front teeth, veneers can just close them,
Right.
creating a really unified, even smile line.
And the big advantage here compared to, say, orthodontics is time, right?
It's all about the time commitment. Braces or aligners physically move the whole tooth, root and all. That can take, 18 months, 2 years sometime.
A long time.
A very long time. Veneers, on the other hand, are just applied to the tooth as it is. They just widen the visible surface to close that gap. For a purely cosmetic gap, it's a non-invasive shortcut.
Okay, that makes total sense. Let's move to sign number 2, which is about color. Heavily stained or discolored teeth.
And this is a critical one. We aren't talking about the kind of surface yellowing that a professional whitening can fix.
Right.
We're talking about intrinsic stains. Stains that are deep inside the tooth structure itself.
What would cause something like that?
It can be from a number of things. Sometimes certain medications like the antibiotic tetracycline, if you took it as a kid, or trauma to a tooth can cause it to darken from the inside out.
And no amount of bleaching is going to fix that.
No, it just won't penetrate deep enough. And that is where porcelain veneers are just the perfect solution. The veneer completely masks that deep discoloration.
Giving you a permanent, bright smile that's also resistant to future stains.
Exactly. It just resets the whole color profile.
Okay, let's talk about sign number 3, crooked teeth. But specifically, minor misalignments. This feels like an area where you have to be really precise.
Precision is key here, you're right. Veneers can give the illusion of straightness.
The illusion. I like that.
Yeah. If you have a tooth that's just slightly rotated or a little bit behind the others, a veneer can be shaped to cover that, making the whole smile line look perfectly aligned.
So what's the dividing line? When do you need veneers versus when do you absolutely need orthodontics?
The line is really about function, what we call occlusion, or your bite.
How your teeth meet.
Right. If the misalignment is causing bite problems, jaw pain, or uneven wear on your teeth, you need to physically move those teeth with orthodontics. Veneers can't fix your bite. They just fix the appearance.
So it's a cosmetic fix for visual straightness, not a functional one. That's a huge distinction.
A crucial one.
Okay, sign number 4 is one I think people might overlook. Worn down teeth.
It's a massive indicator. Over a lifetime of chewing, or especially for people who grind their teeth, a condition called bruxism, the enamel on the edges just wears away.
And the teeth actually get shorter.
They get shorter, sometimes significantly. And when that happens, the smile can look compressed or even a bit older. Veneers are a fantastic way to restore that original youthful length. It can revitalize the whole face.
I can see that. Okay, sign number 5. Chipped or cracked teeth. This seems pretty obvious, but is there a benefit beyond just covering it up?
There's a vital dual benefit. Of course, the veneer covers the chip and makes the tooth look perfect. But, and this is key, the bonding process adds significant strength back to the tooth.
So it's like a shield.
It is. It acts as a durable shield, protecting that damaged area from biting forces and helping prevent any further harm. It's a protective restoration.
So it reinforces the weakened tooth. That's more than just a cosmetic upgrade.
Precisely.
And finally, sign number 6, which kind of brings us full circle back to color. Teeth that just don't respond well to whitening treatments.
Right. This is for the person who has tried everything. They've done multiple rounds of professional in-office whitening, not just the drugstore strips, and they still see disappointing results.
Why does that happen?
It could be that their natural enamel is just resistant to the bleaching agent, or the underlying discoloration is just too deep and widespread.
So the repeated disappointment is actually a sign in itself.
It absolutely is. It raises the question, why keep spending time and money on something that isn't working? When whitening fails, veneers offer a permanent, predictable, and final solution to get that brighter smile you want.
That makes perfect sense. Okay, that's a great breakdown of the 6 signs. Let's zoom out a bit and talk about the big universal advantages of veneers.
The first one we've touched on is longevity. This is an investment. With proper care, brushing, flossing, regular checkups, porcelain veneers can last between 10 and 15 years.
A decade or more. That's impressive. What about the procedure itself? People worry about having their teeth filed down.
That brings us to benefit number 2. Minimal alteration. This is a huge selling point. A dental crown, for example, requires removing a lot of the original tooth.
A lot more, right.
Much more. A crown covers the whole tooth, but a veneer just requires a tiny bit of shaping on the front surface, often less than a millimeter. Just enough for the veneer to fit perfectly without looking bulky.
And that preserves the natural tooth underneath?
Absolutely. It's a very conservative procedure. And the third benefit is just pure aesthetics. These aren't one-size-fits-all. They're completely custom designed to match the exact shade, texture, and translucency of natural teeth. The goal is a seamless, undetectable result.
So if someone listening right now has checked off a few of those signs, the gaps, the wear, the stubborn staining, what is the practical next step for them?
The first step always is to schedule an in-depth consultation with a qualified aesthetic dentist.
This isn't something you just order?
No, not at all. It's a collaborative process. The dentist will do a full exam, check your teeth and gums, and most importantly, they'll sit down and discuss your specific cosmetic goals. What do you want your smile to look like?
And if veneers seem like the right fit?
Then they create a customized treatment plan. It details everything, the exact shade, the shape, the whole procedure. They'll also give you a clear estimate on cost and the timeline involved. Transparency is key.
And again, for anyone in the greater Illinois area, Omni Dental and Medspa offers exactly these kinds of advanced services.
They absolutely do. They're ready to help people from all those surrounding communities we mentioned earlier. They make that initial consultation really easy and informative.
And to take that next step, you can just contact them directly at 847-483-8833, or you can schedule an appointment right on their website.
Right. It's the starting point to really understanding your options.
Excellent. So let's wrap this up with a quick summary. The big takeaway is that dental veneers are a durable, long-lasting, and incredibly natural-looking solution for these deep-seated aesthetic issues, gaps, stains, wear, and they do it all with minimal alteration to your natural teeth.
That covers it perfectly. And for our final thought, here's something for you to consider: connecting durability and customization. If a cosmetic dental solution can last over a decade, 10 to 15 years, and is engineered to be highly resistant to life's daily stains, how does that level of permanent, tailored enhancement fundamentally change the way you value your daily oral care routine, and maybe even more profoundly, your self-confidence? Think about that daily peace of mind that comes from a smile that's designed to be durable and perfect for years to come.
A great thought to leave you with, that link between durability and confidence. Thank you for joining us for this deep dive into aesthetic dentistry and dental veneers.